How do diet, hydration, and medications affect kidney blood test results? Imagine trying to get a clear picture of how well your kidneys are working. Blood tests like serum creatinine and estimated glomerular filtration rate help with that. But did you know that what you eat, how much you drink, and the medicines you take can all influence these results? Let's explore how these factors play a role in kidney health assessments. First, diet has a big impact. Eating lots of meat, especially before a blood test, can temporarily raise your creatinine levels. Creatinine is a waste product from muscle activity, and cooked meat increases blood creatinine because cooking converts some compounds into creatinine. That's why doctors often advise patients to avoid meat for at least 12 hours before testing. On the other hand, people who follow vegetarian or low-meat diets tend to have lower baseline creatinine levels because they consume less dietary creatine. If someone has muscle-wasting diseases or is severely malnourished, their creatinine levels might be lower, which can sometimes mask kidney problems. Athletes or bodybuilders with high muscle mass naturally have higher creatinine levels, but that doesn't necessarily mean their kidneys are not functioning well. Hydration also plays a crucial role. When you're dehydrated, your blood becomes more concentrated, which can artificially elevate creatinine and blood urea nitrogen levels. This happens because dehydration reduces blood flow to the kidneys and slows down their filtering ability temporarily. Drinking enough water helps keep kidney function normal and ensures blood test results are accurate. Severe dehydration or conditions that decrease blood flow to the kidneys, known as pre-renal causes, can lead to what's called acute kidney injury, which shows up as higher serum creatinine and blood urea nitrogen levels. So, staying well hydrated helps prevent misinterpreting these tests. Medications are another important factor. Some drugs can directly or indirectly affect kidney function tests. For example, certain chemotherapy drugs, medications used to treat kidney issues, or drugs that are toxic to the kidneys can cause damage, raising creatinine levels and lowering the estimated glomerular filtration rate. Other medicines may interfere with how creatinine is secreted or measured, leading to false readings. That's why it's essential to tell your healthcare provider about all the medicines, supplements, and herbal products you're taking before a blood test. Sometimes, your doctor might advise stopping certain medications temporarily to get an accurate reading. Other factors also influence kidney test results. Chronic conditions like diabetes and high blood pressure can gradually damage your kidneys, which shows up in abnormal blood tests. Physical activity before testing can temporarily raise creatinine because exercise increases muscle metabolism. Age, pregnancy, and body composition also matter. For example, older adults or pregnant women may have different normal ranges, so interpretation should consider these factors. In the context of kidney health and kidney cancer, understanding how diet, hydration, and medications influence blood tests is vital. Misreading these results can delay diagnosis or lead to unnecessary worry. That's why following pre-test instructions carefully, sharing complete health information with your healthcare team, and seeking personalized advice are so important. Remember, these tests are tools to help assess your kidney health, but they need to be interpreted in the right context. Always consult your healthcare provider for guidance tailored to your individual situation.